I've been in the field of drug and alcohol since 2011, so I've been around for a little while. The reason I personally appreciate the trauma-informed approach and understanding trauma and stuff like that is because, you know, like some of you most likely have been through it, and I went through a lot of this stuff, and just like what we learn when we're interacting with trauma, people who have been through trauma, people who have PTSD and that sort of thing, they're kind of in the same boat where they're figuring out how to navigate themselves while we're figuring out how to navigate with them. And so part of the value of this training is really to understand how to navigate those interactive relationships we have with people with trauma. So a little bit about myself. Like I said, I've been in the field since 2011. Prior to that, I was in addiction for 10 years, started at around the ages 12 to 13. I don't remember when I first got high, but I remember it being around the time I was hitting puberty, and then went all the way through, eventually started cooking methamphetamine, selling methamphetamine, then got to prison, went through the whole prison process, spent 3 years, whether it was in county jail or in prison, got charges for possession of a meth lab and for possession of marijuana with the intent to distribute. Got out of prison, and I actually went through PA Adult and Teen Challenge, this program. And I spent a year in the program. After I completed the program, I spent a little time going to school and then eventually came back to the program. So going through the journey of childhood trauma, childhood challenges, through all of the different venues, working with people who didn't know how to interact with trauma. And again, this is, you know, earlier in the 2000s, not a lot of the prisons had these trauma-informed approaches. That was kind of in the developmental stages. So their way of dealing with trauma was the whole, yelling at you, locking you in your room, or cuffing you until you calmed down. So it was just really kind of shed light on how valuable this stuff is, because I not only saw individuals going through this, but I went through some of it myself in my interaction with different people throughout the process, and even with some counselors, and how differently trauma-informed and trauma-aware counselors were throughout my journey versus people who didn't really understand trauma and didn't know how to react to what they were seeing in me. So that's a little about myself. I want to get to know you guys a little bit. Can we just go around, share your name and what you do and what brought you here? Do you mind starting?
My name is Guillermo Enciso.
Nice to meet you.
I don't work for none. I'm just a parolee trying to learn.
Great.
You know.
We appreciate having you.
JJ, John Arkin. I'm a certified recovery specialist. I also have been in the system and just wanted to see exactly how this all plays out.
Awesome.
In trauma-informed skills, because I see a lot of justice-involved individuals like myself, and I guess it's also going to help me get to know myself a little bit better. So
appreciate that. Thank you.
My name is Janine. I currently work for Teen Challenge / Lehman. I'm the outreach coordinator, I guess you would say. Myself, I was also in the system for many years, and I also need to work on myself as well.
Awesome. Welcome. Thank you.
My name is Jackie. I work at Sarah Jane Bentley Foundation. It's an outpatient counseling center, and I wanted to come just to learn more about trauma-informed skills.
Yeah. Thanks.
Hi, my name is Cindy May, and I'm a certified recovery specialist, and I work for A New Tomorrow.
Nice.
And I came to get credits for my recertification.
Nice. Welcome.
Thank you.
Good morning. My name is Talia Bradley. Well, Talia. I am a CRS and a CPS, but I do work for A New Tomorrow. I work their warm handoff program. I've been in that field for almost 3, going on 4 years. I came to this training because I too have the mental piece connected with my addiction.
Yeah.
I'm also in recovery. I'm coming up on 5 years in like 2 months. So I came here to get more information too that will help me while I'm working in the field, because doing the warm handoff program, we do come across people that are like dual diagnosis, where they have, you know, mental health issues along with the substance abuse, and I just want to be a little more informed so I can better work with my clients.
Yeah, thanks for sharing.
Hey everyone, my name's Jay. I work for the Borough of Carlisle. I'm a co-responder.
Okay.
Addiction brought me into this field. I've been working in it since 2021. But I I sit in a pretty cool position where I can teach the police that addicts are human too.
Yeah. Yeah.
So this will help.
Yeah. Awesome. Thanks.
I'm Steve. I'm the Program Director of Anchor Peer Support Services. We're a multi-county CRS standalone. Provide services to anybody that needs, no matter where they could possibly qualify from somewhere else. And really just opportunity to be able to get some education. And we do see a lot of people that are justice involved. Most of my employees are justice involved. And so I was grateful for the opportunity. Janine invited me, so I was like, okay. Don't have anything else going on today, so I figured I'd come up here.
Yeah.
My name's Shelda. I'm a CRS as well. I work for A New Tomorrow. So
Great.
I know we have those. I just want to get more education on this, working with people.
Thanks.
So,
My name is Edith Cook. I'm one of the founders of A New Tomorrow,
Okay.
and I've been in the field for over 28 years. I've been in recovery for 30.
Congratulations.
I do a lot of trauma informed, and I always feel like anytime someone's teaching about trauma informed, you can never get enough of it.
Awesome.
Good morning, my name is Jenny Payne, and I also work for New Tomorrow. I'm a CF4S, and I'm in the process of becoming a certified recovery specialist.
Good for you.
I've been in recovery for a little over 20 years, and I'm glad to be here.
Yeah. Great. Great. Everyone. Go ahead, Brian.
Everling. I work for Naaman Network and Pennsylvania Adult Teen Challenge, and I'm a business development and community outreach rep for Lehigh, Bucks, Northampton, and Montgomery County as of a month and a half ago.
Okay.
But I've been with the organization for over 10 years, and I went through the program, graduate of 2013, and in recovery also.
All right. You guys got to share too, hiding in the corner. Yeah.
My name is Amanda Vanderlinden. I work for Pennsylvania Adult Teen Challenge in the Advancement Fundraising Grant sector.
My name's Kevin. I work for Sun Ministries in the IT department in marketing.
All right. All right. Thank you guys for coming. And what's really, I just want to share this. Many of you are in the CRS case management, field and stuff like that. I was actually in a meeting yesterday, and they were talking about the impact that case managers and CRS has had on client outcomes. And they're among the top of the things that impact their recovery rates, their follow through with other programs, is the power of your interaction with them. So I want to say, for those of you in case management, working with even just a cohort with people, encouraging them through the process, that has a huge impact on their outcomes, a huge impact on their recovery rates, the encouragement they feel through the process. So thank you guys for what you do. So a little bit about why this training matters. Justice involved individuals and generally individuals as a whole. Before I go through this, one other side note, I have a private practice. I'm a licensed professional counselor, a certified advanced alcohol and drug counselor, and I have a private practice. And the only reason I share that isn't to self-promote. It's to tell you that I work with couples in the evenings in my private practice. And I use every single one of these tools and teach multiple couples over and over how to utilize these tools and interacting with each other. So these things have, the value with justice involved. They have the value in the addictions population, but these things also have tremendous value in just life skills, relationship skills, understanding when someone's reacting to something and you don't understand the reaction because it doesn't fit the scenario. That could be trauma. And your ability to identify those behaviors, which we'll go over, and react to them appropriately can really help stabilize and sustain that relationship. And just through those healthy interactions, that person's allowed to move forward in their healing process. So I just want to add that in. So if you hear me bring up couples and you hear me bring up relationships throughout this training, which I may or may not do, that's where that comes from, is that seeing this stuff come alive outside of these populations. So justice-involved individuals experience trauma at an extraordinary rate, often 80 to 98%. Many carry complex chronic trauma from childhood abuse, community violence, loss, or incarceration itself. What looks like defiance, manipulation, and non-compliance is frequently a trauma survival response that once helped the person stay alive. these responses do not disappear when someone enters a justice system or returns to the community or even in treatment, right? These don't lose these survival skills. And one of the things you'll hear me say on repeat is survival, right? The tools that you learned to survive, your system, your body, your mind, your spirit wants to globalize those tools to every interaction. Why? Because the value of survival isn't limited to that one moment of surviving. It expands. You use the tools you know to try to fix everything. So when you get into an interaction with something that reminds you of when you needed to survive, whether that was a child, adolescent, or anything like that, you're going to take the same tools that help you survive there. Well, when you're 10 years old or 8 years old and you go through trauma, you're maybe flipping out, maybe running away, maybe fighting, and then when you're put in a space, you can't use those tools without getting in trouble or getting consequences or having a negative interaction. All of a sudden you risk becoming extremely dysregulated. And for a population that has an extremely high rate of ACEs or adverse childhood events, their pattern of responding this way becomes extremely high. Trauma-informed care is not soft. It is a set of practical skills that reduce incidents, improve safety for everyone, lower burnout, and supports better outcomes. And it may be a little bit of a dated mindset, but it still exists for some people, where they look at trauma-informed approaches as soft or as not effective. But there's overwhelming research now showing that if you're able to bring someone back, you're able to ground them, you're able to get them out of their survival skills, then their outcomes begin to increase. Their ability to engage in any programs, any supports, any aftercare options, and even following rules in a justice system. If they're in prison and you're able to use these tools, the research of a trauma-informed environment of incarceration reduces the amount of incidents of misbehaviors or of challenges that everybody face. So when you're thinking about this, don't think that, this may not be holding them accountable, or this may not be, this is a step in the process, right? This is a step to get them back in what we call window of tolerance, a step to get them back into being grounded and being able to kind of function and process things in the moment, and then getting them back into engaging with the program, engaging with you. And I'll give you some scenarios where I had to learn this stuff in my very early years firsthand, and what that looked like for me to really need to challenge myself in figuring out. So our learning objectives for today is to identify common trauma responses in justice-involved individuals and assess their severity using a clear and practical framework. Is to apply de-escalation tools that prioritize safety, dignity, and emotional regulation over control or compliance. And then finally, to use self-regulation mindsets and techniques such as empathy, depersonalization, trigger awareness to stay grounded and reduce secondary stress. And just to share some quick data that's not in my notes, so I don't want to forget it. This idea of secondary stress is very real. When somebody witnesses trauma, their brain begins to change. When they witness these traumatic events, whether it's in the justice system, in the community, and it's happening to someone else, it still changes their brain. Their brain begins to metabolize protein differently and changes the structure of their brain. And some people are more vulnerable to these changes than others, but over time they can really erode the person, and then they can have a type of vicarious PTSD from it. So this idea of coming out of these things and grounding yourself and being able to do the same things you're coaching that person on for yourself after the fact are extraordinarily important to re-regulate your brain and to re-ground yourself so that you don't have these effects of trauma happening to you that you're seeing happen to someone else in those moments. So let's take just a couple minutes, and I'd like for you to grab your pre-training assessment and just fill that out real quickly if you don't mind. Should be in the folders.
Yeah, there's a separate paper.
Perfect. There should be a pre and post test.
That one has our letterhead at the top.
Yep. If you don't mind filling out the pre-test real quickly, and if anybody has any questions, I want this to be as interactive of a training as possible. So while you're filling those out, if a question pops into your head, or if a question pops in anytime during this training, feel free to ask it.
Are we doing just the front or the back?
Just the front.
Oh, okay.
They're both the same. So one is a pre and the other one's a post.
Oh, okay.
You don't have them back?
No, I don't.
On yours? Oh, you're using one from the slide.
It's on the other side of the folder.
Yeah, so it's in the folder.
It's that one right there, Jay.
This is free anyhow, so.
Yeah, that's fine.
Free on the
cool.
front.
You'll get to the post one and just turn that in. That'll be fine. Yep.
Because this,
So if you did it on the slide, don't worry about it. Just turn the slide in when we're done and keep the other slides. And then just, there'll be a post one at the end of the slides. You can turn that one in when we're done. Both will be just fine. They're exactly the same. What seems like most everybody's done, so I'll keep moving on. So identifying common responses and assessing their severity. So, and again, if you see times on the slides, those times were before I kind of talked to the team and found out we usually run these for about 2 hours because they provide lunch. So the times aren't accurate. So if you look at this and wonder if we're going the full 3 hours, no, we'll stop for lunch around 11 o'clock. So, trauma is the norm, not the exception. So this is really important to understand. When you're interacting with a justice-involved individual and substance-using individuals, you're going to want to remember that trauma is the norm. So it's more than likely that that person has had some trauma and may exhibit some trauma responses as you're interacting with them. Because like I shared a little bit ago, 80 to 98% of justice-involved individuals have significant trauma histories. They're 4 to 5 times the rate higher of multiple adverse childhood events compared to the general population. 30 to 60% of men in state prisons show PTSD symptoms, which is much higher than the general population, and 12 to 38% of women in prison show PTSD symptoms, often even higher. And I'm going to share this. I just learned this while I was studying for this training, and it's an insane study. And again, in my opinion, it's a little bit of a projection, right? They had to project what these numbers would be, but they project that the cost on society of trauma is around $14 trillion annually. The causes of death for people who have experienced trauma cover all 9 of the top 10 causes of death. They are more likely to get any of those top 9 when they have a history of severe trauma, right? So when you're working with individuals in trauma, really important insight to them is that it's not just their mind that's dysregulated. Their entire system is dysregulated. There was a book I read a long time ago called The Body Bears the Burden, and it was all about how your hormone structure changes with trauma, your brain, your neurology changes, the way that you break down proteins, the way that you react in moments, the different parts of your brains that grow and shrink as a result of trauma. All of that changes. So when you're interacting with people with trauma, you're talking to a biologically different makeup, because their entire system has adjusted to compensate for that trauma and that load of stress that now entered their system, which the body has to adjust to the stress. It has to do something with that. It can't just go into the system and not be dealt with. And so the system deals with it the best way it knows how. And a lot of times that over time creates disease and creates challenges and struggles for those individuals. And so the need for empathy and the need for understanding what this individual is going through physically and psychologically when they're reacting the way they're reacting can really help ground us in that moment to understand their real need is compassion. Their real need is a soft and gentle approach, someone who really exemplifies that they care about them in that moment. I think I shared this, but 12 to 38% of women in prison show PTSD symptoms, and this rate is often higher depending on the sample size they pull from. So before we go to the next slide, I don't think you guys can see it. I want to ask, what do you think, or what have you experienced to be common responses of trauma? Oh, you guys got the slides in front of you. Don't cheat. So what do you think the common responses to trauma are? Go ahead.
I don't know if it's common, but I see it all the time. Overusing sorry.
Yeah?
I'm so sorry.
Yeah, that's a really good note. I will say on that note, personality really impacts the way that the direction that someone goes in their response to trauma, right? It's that fight, flight, freeze. Does anybody know the last one? Fawn. That's that fawning, that oh, I'm so sorry. You know, they're trying to please you, and they're trying to make things okay in their environment. Anybody else?
That and sort of on that, the whole compliant, non-compliant, like the basically like saying yes all the time.
Yeah.
Like yeah.
Yeah.
And then I also like you know what I mean.
Mm-hmm.
People were trying to verify. I mean, like literally, do you understand them? Yeah, I've seen that before. A lot of people with trauma. That phrase, you know what I mean.
Yep.
It does come out of that.
Yeah.
I even see like their eyes looking for safe space.
Yeah. The hypervigilance. Yeah.
Yeah, like or like backing up, trying to find a safe place to stay.
And sometimes there's two things, right? Sometimes it's a very primal trait of acknowledging authority, right? And it's a fear-based acknowledgement. It's not like a peer where I trust what you're coming. It's a fear-based where, just like if you ever do this with an animal and look intently in their eyes, if they're acknowledging you as a leader, they will look down or look away, their ears will go back, right? I don't know if you guys ever watch that dog whisperer guy. I love him because the reality is he's working with animal trauma, and he's correcting that by distraction and engagement in healthy activities, right? But that's exact behavior you see in some humans. And the more, this is really interesting, and I'll keep going, but I don't think this is in my slides. The more nonverbal their reaction is, the earlier the trauma happened. So when you start seeing these strong nonverbal behavioral cues, usually what's that telling you is that some of that trauma may be pre-verbal. And they may not even understand or have an idea of what happened to them, because that was pre-memory forming times in their lives. Okay? Anyone else? All right, we'll keep going. So I'll start going over these. The common trauma responses in justice setting, and this is just common in general. Hypervigilance, right? That's that kind of, spatial awareness, scanning, looking for exits. They may, if you're walking towards them, they may be trying to back away from a corner, right? Some of that is because they've been in prison for a while and their brain is attuned to, I need to keep myself in a place where I can get away from you, because I don't trust you, I don't trust what you're going to do to me. And for someone who's not aware of what's happening and their need to have that space, they may keep moving forward. Not out of a desire to hurt the person, just because they don't know what this behavior means. They just assume they're trying to get away and they're trying to communicate with them or have an exchange with them.
I got a
Go ahead.
question. So when you're like seeing people going through that, and if you're, say it's just you and that person, and saying was like when you're one-on-one with someone
Yep.
that has experienced trauma, I found, and this might just be my own personal thing, sometimes their reaction or their movement can trigger my own trauma.
Yeah.
For instance, I thought, like, am I going crazy? Like, I had a gentleman, and sometimes we can tell when something's not right. And we were in a closed area. When where I went to meet him at was just a safe place. So they put us in like a closed area, but I can see as I'm talking to him, and I'm like going as slow as possible, but I can see like they're doing, like with the head down and in my mind, I'm ready to fly, because I'm like, is he about to do something? But I'm trying to be as calm as possible and trying to help this person, but I can tell that something is off and something is not right. So I had to, in my mind, mentally think about grounding techniques for myself.
Yeah.
You know what I mean? So I can stay grounded, and it's because I don't want him to think that I'm afraid, him or her to think that I'm afraid of them by their movements. But I have noticed that when I know that, especially when we're in a closed area.
Yeah.
You know what I mean? I'm like, I hope this person doesn't like attack me, or you know what I mean,
Yeah.
or run to the door, and because normally I don't keep the doors closed. It's like we'll just pull the door up for privacy, but the individual closed the door completely, and maybe that was his way because he wanted to feel safe.
Yep.
I didn't say anything, but his movement started to trigger something, and I had to, like, in my mind, mentally just ground my own self so I can feel safe with that individual. So I was just not like, I was asking. I know I'm not crazy. That can happen right away.
Oh yeah, yeah. Oh yeah.
Your own trauma or whatever you have experienced.
And the last thing you want is your trauma to start talking to their trauma.
Right.
Right? You don't want that. It's like when my ADHD starts talking to someone else's ADHD, it's over. Right? It's not good. So you're 100% right. You absolutely want to ground yourself because people can sense your, let's use the word aura.
Right.
They can sense where you're at.
That's what I was afraid of but I was sensing his, and it kind of got me kind of like, wait a minute, you know what I mean?
And that's when
I don't want anything to happen for him to like, do anything to me. The end of our conversation or whatever was, he like just abruptly jumped up. Oh, I had a bad day and I'm not ready for this, so I knew something was off, and I didn't want to push him. So I felt that my space was kind of violated too. But how do you learn how to protect your own space while you're protecting someone else's space that's going through it at that moment?
So you're doing the same thing you're doing for him, which I think this will help explain it. Same thing you're doing for him, you're doing for yourself.
Right.
And I'm going to summarize it as a window of tolerance, and we'll get into this a little bit later too. But that window of tolerance, if you're interacting with someone, right, and you're beginning to do things that are taking them out of their window of tolerance, you want to be very aware of the change in their behavioral responses.
Right.
And the more you're attuned to their behavioral response changes, the more you're assessing, I'm taking him out of his window of tolerance.
Yeah, because I felt like, we don't have to do this right now, you know what I mean? And I was finding myself asking him, is everything okay?
Yeah.
Am I talking too fast? Or, because I never want to push anybody and turn them away, and he just kept, the person kept saying, it's not you. But I could just sense, because then it was like, just all type of different movements. Like, I know if he was going to run or if he was going to try to attack me, and then it brought up stuff.
And sometimes you can ask questions that help reframe, like, what do you need right now?
Yeah.
I can see, it's okay to call out, I can
Right.
see that you're uncomfortable.
Yeah, and that's one thing I did.
The last thing-
Everything okay? Do
Yeah.
you need me to, what can I do for you?
Yeah.
Is there something I can do for you right now?
Yeah, and that's great, because what does that create? Cooperation. Even if they say, no, not right now,
Right.
right? That's still cooperation. That's saying there's nothing you can do for me. Listen, if there's anything, if you just need to go and drink a cold cup of water, if you need to go, just I want you to feel safe with me. And if you let me know how to make that happen, I'm more than happy to help you with that.
Yeah, and then you
Right?
run into some people that are just like, now you're mad because like, I don't want to be ignorant. Like I didn't call you, you called me. You know what I
Yep.
mean? But some of them are like, what the F are you here for? You know, and their attitude is just, so I have to like, what do you want? What do you
Yep.
need from me? How can I be of service to you? You know, I have
Yep.
to go that route too because, yeah.
And it's very common, right? And that's even in this, that avoidance.
Yeah,
Right?
and I think that they do that because they have some trauma experience. You know what I
Yeah.
mean?
And then there's the emotional numbing when you see them completely shut down. And this is
Right.
wild. How many of you guys have ever heard of attachment styles? I'm sure it's a pretty well-known theory. So with attachment styles, right? It's a relationship term. It's whether or not when there's conflict in the relationship, you engage, right? You're conflict pursuant, meaning you have to have the conflict in order to feel safe in the relationship, versus conflict avoidance, right? Where you shut down during conflict. You get quiet. You try to avoid engagement, right?
Yeah, that's when someone is not like considered non-confrontational.
Yeah. But what they've studied and what's really interesting about those two different things is even in couples, even in healthy relationships, the person who's yelling and the person who's sitting quietly on the couch with their head down have the same amount of stress running through their blood, have the same amount of cortisol. They're experiencing the same thing, but the physiological expression of it is very different. So you may have someone who's shut down and seems calm, but really they're pulsing with stress in that moment. And they need that same,
You shut down.
I was in the middle of a biopsychosocial yesterday, and I saw that, and I just allowed this to end. Because I knew the questions were taking her someplace that she couldn't handle with so much. And her nonverbals were screaming at me.
Yeah,
And I was
good
like,
for you. That's awesome.
let's take a break.
Yeah.
We don't have to finish this today.
Yeah.
We're gonna do this at your term, your pace. It said we have 7 days to get it done,
Yeah.
but and
To be honest with you guys, I'll skip the questions entirely. I do not care. I will skip them entirely. If I see that person cannot handle processing this stuff, I will put did not answer, not prepared to answer, answering would be unhealthy at this time. I will put anything but make them answer. I did mental health sessions for 2 years, and there were some ladies that would come to the meeting and say, I can't answer this with you. Oh, that's fine. Do you mind me answering the question, or is that triggering? And they would say, you know what, you can ask the question and I'll just tell you. I said, that's totally fine. I would get this one young lady in, she refuses to answer every question. And I'm usually typing while I'm doing these. We get to the end of the session and she goes, can we talk for a little bit? I said, sure. She went through and told me her story and answered every single question. Once she had enough trust that I was there for her, that I wasn't there to do a job. And I said to her, I said, I'm here. These assessments are just to support your treatment. That's it. If you don't want to answer them, that's fine. I'm not going to feel bad. I hope you don't feel bad about it. You do what you need to get the best out of what we can offer as a program. Anything else is outside of what we need to do here. And by the time I got done, she was opening up. She processed with me. She's like, I want to work on with my counselor. I'm just afraid to talk about it. I'm afraid of the reaction. I'm afraid of the face. And I said, well, would you mind if maybe we did this together with your counselor? And she goes, yeah, that would be great. And so I just sat in the room quietly, and she began to open up, and she began to do some really good trauma work while she was in there. So you never know what's needed specifically in those situations, but if you back up and let them guide a little bit and work kind of that supportive role, which we'll get into, you'll often find they'll tell you what they need, but it just takes that time. And sometimes the need is just not to, like you were talking about, Sometimes the need is they want to get out of the feeling that you're doing a job, right? Once they bypass that feeling that you're there to do a job, that has been the shift that I've seen most doors with people's trauma open. Is the moment they believe I'm there for them, total shift.
Yeah.
But as long as they believe I'm there to do a job, just like everybody else that's ever been there before.
Especially whenever basically, like you said, like, I mean, when literally they've engaged so many times with people that are supposed to be helping them, and none of them help them.
Yeah.
Or they've helped them like in a very minimal way, or they've hurt them.
Yeah. And I've dealt with that. In training new counselors, I've said to them, listen, do not open up this trauma door. I was like, it is extraordinarily unhealthy sometimes to ask these questions when you're only with the person for a day, 2 days, a week. I was like, don't do it. Just skip the questions. I was like, you'll never get in trouble by the state for saying, client not prepared to answer. You'll never get in trouble for that. I never have been, and it's on tons of my stuff. Why? Because the window in which I work with them, I'm going to open up a scar and let them leave the hospital with no bandage on it, right? No healing process, no scar, no scabbing, nothing. They're going with an open wound. Well, what's going to happen? That's going to get infected. The moment they walk out of the door, the first time they get back home and somebody re-traumatizes them, it's going to get infected. So you really have to be conscious of some of these different aspects of trauma, especially when you're seeing these common signs, right? So just to keep going, disassociation is a big one, and it's sometimes hard to target, because sometimes the disassociation can be over-compliance, right? Sometimes the disassociation can look like other things, but it's when they're disconnected, right? Or when they're behaving in a way that's kind of alternative to their behavior. Mistrust of authority, resistance to rules and to staff. That's a very common one that is a reflection of a trauma, right? But if our brains aren't attuned to that trauma, we look at it as rule breaking. So what do? We tell them about the rules, right? Well, it's a waste of time because that's not what's happening there. This isn't a break in rules. This is a trauma response to the environment. So irritability, being quick to anger, low frustration tolerance. Impulsivity and risk-taking is really important because it is a form of distracting. With ADHD people, they do their own form of like EMDR, they do their own form of coping where they distract, right? And they push their trauma to their subconscious and they impulsively engage in the next activity, right? And oftentimes then that trauma kind of comes back in bursts. And so with risk takers and impulsivity, oftentimes you'll see bursts of that trauma come out in different areas, but it's hard for someone with ADHD to stay focused on the processing. And then you have the fight, flight, freeze, fawn response. So the next one is assessing severity, a practical framework. So if you have a relationship with this person, you're going to be, the first thing is frequency. You see a behavior pattern, you're asking yourself, how often does this happen? Is this something that the client has zero control of, semi-control of? Are they aware that it's even happening? What's the length of time? What's the intensity? How long are these episodes happening where they kind of are in these trauma responses? And what's their functional impact? How much does this interfere with their safety and daily function? Kind of like what, with her story. I love her story because she had to assess, am I safe? Am I okay? Is my trauma responding appropriately to this situation? That's exactly what we're trying to teach them. Do you need these tools you once needed to survive this situation of our interaction, right? Because if you do, good for you. Use them. But if you can kind of join me in understanding that you don't need these tools, then I can support you in this moment, right? And so you're trying to figure out functional impact, how much that is interfering with the safety of you and the team and the safety of that individual in their daily functioning. And then triggers. If you can figure out what set them off, right? It's not going to make sense to you. Someone moved my shoes. I don't know what that means to them. Right. I have no idea, right? Some of the worst experiences of a client losing their mind, for lack of better terms, was over the most minimal things, right? Just you never know what's going to trigger that. You don't know why it's going to trigger it. But if you can start to see a pattern in what do trigger them, you can start to find the theme that they may be missing. And that can be a great tool once they regulate to helping them develop that self-awareness and that ability to maintain mindfulness in those moments.
This works really good too, like with my kids. Like my son has trauma that, I mean, we all have trauma, but he doesn't see anybody for it. So like, as a mom, I'm grateful for today. I'm able to understand like he's not just being a jerk. Like, it comes from a place of hurt and pain and suffering, and you know, just to be patient with him. So
absolutely,
I'm grateful for that.
And that's great. We'll get into more of that towards the end, but that is a really important thing to be aware of. So the key reframe, the behavior that appears manipulative, defiant, and non-compliant may actually be a brilliant survival adaptation from the past that are now mismatched to the present environment. And again, that's the thing that's so important to remember, right? I always try to remind myself, this is their resilience. I'm getting a reflection of what got them through the hardest times in their life. This is a image of power in their life that they have not been able to let go of. They have not felt safe enough to let go of this tool. And if I can be that sense of safety in some way, then I get to watch them set down tools they've held on for many years.
Absolutely.
Right? And that's a joy. Go ahead.
I used to do a group at the Veterans Center in the dark.
Yeah.
With Vietnam and global Persian Gulf.
Yeah.
And they used to talk about, in the dark, what war was the worst?
Yeah.
I'm in there in the dark saying, only female, it was all men group. And I was sitting there saying, how do I effectively help this group? Because this is really not helping them.
Yeah.
You know, and I kept going to my professor, she kept saying, you gotta work on certain things. There's a lot of things that you're covering. And one day I was at Lowe's in the flower department and I ran across these lights that lit up. So I went to the group and I introduced that, can I bring lights into the group? And they were like, maybe. I said, when you feel safe to talk, we'll turn the light on. Now that group meets in a room with daylight.
That's awesome. Yeah.
But it took, like everything you're talking about, like it took me back to that moment.
Yeah.
Because they were so comfortable in that trauma that they really didn't want to come out of it because it was a comfortable place for them.
Well, and you're absolutely right. Why is it comfortable? Because it's the tool for survival. That's why. It's like me asking you, like, to take all the safety equipment out of your car. How many of you guys got a car that warns you of the braking thing? Right? I just got a car and it warns me now of the braking thing. I didn't know about that, but I stinking love it. Right? I would never want that to leave again. Why? Because it's a prevention to an accident. Right? I hope I'm a safe driver, but you never know. But it's like those safety things, even the simple ones in your life, you don't realize how many there are. You don't realize how many things. I think you lock the door behind you when you walk in your house. Someone says to you, don't stop locking your door. You're going to be like, no. You know what I mean? That's exactly what you're trying to give them, because in their world, right, the darkness is safety. The darkness may have been the only time they could sleep because nobody could see,
They
right?
said it reminded them about being in bunkers.
Right? Around people that would risk their lives for them, right? So you never know what it means to them, right? You never know why these things are important. But if you can begin to desensitize them, but I bet you they trusted you.
Yeah.
By the time you got to that place, they trusted you. They believed you were there for them and not yourself.
Their wives came with all kinds of gifts. I said, I can't take them.
Right.
Because they couldn't be out in the daytime with their husbands.
You don't get that unless they're going home and saying, she cares about us. Right? You don't get any of that until that trust. Right? And once you have that trust, that's the space that work begins to happen. So we're going to skip the activities because I looked at the time and we're moving along really quickly. So we're going to go into tools for client participation and de-escalation. So what de-escalation really looks like. And again, this is the biggest thing I think I want to stress throughout this entire process is just developing a new mindset, right? Making sure that you're not dragging any ways of thinking in that are going to hinder that individual from regulating, right? Because you got to go through regulation to get to healing. You got to go through regulation to get to compliance. You can't have the two mutually exclusive. So what de-escalation really is? It's not about winning or forcing immediate compliance. It is about helping the person return to a regulated state so that thinking and problem solving become possible again. So I'm going to share a story that was kind of part of the last activity, but I'm going to bring it into this to give you guys an insight into why de-escalation, why knowing yourself, like you were sharing about knowing your trauma, is so important, right? So I said before, I was in prison. I did 2 years in prison, 1 year in county, and I watched the way that I watched trauma happen all around me, and I'm bigger, so people didn't generally mess with me, but like there was a few incidents and stuff like that. So I knew how to, like the hypervigilance, the watching spaces, I went through all that for a handful of years. But I get into working with individuals, and I'm only 3.5 years sober. I'm working as an assistant counselor, and one of my toughest clients comes into my office, and he was in biker gangs. He was, really, really intense childhood trauma. And I'm new to the field. I don't understand trauma well. I don't understand a lot of things well, but I had to figure this out because he was in my office cursing me out, kicking my desk, losing his mind. And I'm thinking in my head, am I going to have to hit this guy? Right? Because I'm thinking still with the safety mentality. I'm not thinking this is his trauma. I'm thinking I'm going to have to fight this guy because he's also in between me and the door, right? And all I'm thinking about for the first about 3 minutes of that was, what do I need to do to get to the door, right? And then my brain, I began to get used to it. And I began to remind myself what setting I was in, what setting he was in, and what he was going through. And I got up and I said his name and I said, listen, I said, I need you to stop right now. I said, I'm starting to get really upset and I don't want to be upset. I want to understand what you're saying and I can't right now because all I'm thinking about is how upset you are. And I said, and I'm not okay right now. I said, can you go outside of my office for 5 minutes and I promise you can come in and finish where you left off? And he left my office and I reread his biopsychosocial. I opened it back up to remind myself, what is going on here? Well, as a 3-year-old, from 3 years old, he can remember his mom getting abused. From early. And so I let him come back in and I sat through. And this took about 25 minutes. But the whole time in my head, I'm like, this is how he survived. This is all he knows is fear. All his life, fear, 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 fear. And right now, he's just afraid. It may not look like that because he's addressing it with anger, which is a great way to mask fear. It's just fear. It took him about 25 minutes to calm down. And finally he calmed down. And I said, what do you think is the most upsetting thing for you in all of this? And he was able to finally in one sentence share what set him off and what he was so upset about. And even though what he was really upset about made no sense to me, I was able to work with him on it. And I walked back down. It's something that happened at his workspace when he was in part of the work program. I walked back down with him to the work program. I spent some time with him down there, probably about 20 minutes is all it took. And he was perfectly happy. And this was a client who called me multiple years after he left the program. And he still struggled a lot. He would call me and be like, I'm barely making it and stuff like that. But those little impacts of understanding his need in that moment and meeting him where he was at was all it took to build the rapport needed to see him heal through many different patterns of fear.
I think one of the most important things is when you're interacting with somebody that's trying to meet them where they're at.
Absolutely. And so you're trying to bring into your thinking what is happening internally for them, and remind yourself just how important this pattern is for them. So when someone is in high arousal, the amygdala driven, the survival mode, their prefrontal cortex, which is reasoning, and their ability to do impulse control has shut down. It's their executive functioning, it's gone right now, and their survival mechanisms is the only thing in control. So your calm presence and specific techniques can help their nervous system come back into the window of tolerance, right? So they're assessing you the entire time. They're almost waiting for you to dysregulate. They're waiting for you to prove them right, right? And that's a dangerous place to be, because they're testing you. And if you fail the test, you prove their trauma. You prove they need those tools, right? And the problem with people who aren't trauma informed, they're constantly reaffirming that individual's need for those tools. So that's why they continue to go back to them. And so the core principles are prioritize safety, obviously. I don't know how many of my staff called me and said, this guy's freaking out, what's he doing, what's he saying? Just leave. Just walk out. Who cares if he destroys the whole building? Just don't be in it when he does it. Get yourself safe. I've had to tell many of them that. But if it's safe, and you assess that it's safe, and you are safe, regulation, calm, interactive presence, and then dignity, right? Affirm him, right? Just like that guy, I want to hear you, bud. I do. I can't right now. I'm not in the right headspace. Like, you're setting me off. And I didn't ever say you're setting me off, but he was. He was making me angry, and I didn't want to be angry in that moment. I didn't want to be upset with him in that moment. I wanted to calm down and do something for him in that moment. And if I can communicate, validate, and show him dignity through that, which we were able to do, he was able to leave my office. And I heard him cursing outside of my office. He didn't exactly calm down while he was out there. But we were able to get him back in and get him regulated. So dignity over control or compliance. And then, so the core de-escalation tools, a grounding presence. Like I said, they can sense your nervous system. Like I said, I love that dog whisperer show. I don't know, how many of you guys have seen it?
Caesar Malone?
Yeah, Caesar Malone, that's his name, Caesar. If you haven't seen it, it's great to watch. Who's the person whose fault it is that the dog's all jacked up?
The owner.
The owner.
Who's the owner?
Why? He says to the owner, your presence is causing this animal's fear. The state of being you're in is causing their insecurity, right? And so if we can correct the state that you're in, the dog will adjust. Well, the same system that's in animals for survival is the same system in us. They have an amygdala, they have motor control, they have all that stuff that we have. Well, guess what? Their system is responding to us. And if we're dysregulated, they can sense it. Because they had to. They had to know when Dad was walking in the house if Dad was going to be violent that day or if Dad was going to be cool that day, right? They had to know that before he ever even opened his mouth. Well, how do they do that? They became very attuned to people's nervous system. They became very attuned to their environment, and they're hyper aware, more aware than many other people are. And so your grounding presence, slow your breathing, lower and in a calm voice, maintain a safe distance and open body language. And I can't express enough the open body language, right? I had a guy threatening to kill me one time in a hallway. He was very upset. He was not someone who it was outside of his scope to really hurt someone, right? And what was happening is a crowd was forming. One, not good. Two, multiple staff were approaching. Also, not good, right? Both of those things combined is enough to make him go into escape mode because they're blocking all the exits, right? So if he's hypervigilant, it's over. So first thing, get out. Don't worry about me, get out, get out. I watched him calm down, not a lot, but a little bit. And he started coming towards me. And I just slowly backed away, just like this. And I started talking to him just like I'm talking to you now. And I said, listen, I can see you're upset. And I know something's bothering you, but I don't know what it is. I said, if you can help me understand, maybe I can help you get what you need. And this carried on for about 10 minutes. He cursed me out. He said, I'm gonna kill somebody. I'm gonna kill you. I'm gonna effing whatever. He's still going. Finally, he goes, I just wanna go home. I was like, if I got you a bus ticket right now, would that help? And I said, you gotta promise me you'll check into this aftercare program, but I'll get you a bus ticket. I said, can you do that for me? He said, yeah, we bought him a bus ticket. He left the program AMA. I didn't even have to administratively discharge him, right? For threats of insanity. But what did he need? He needed an open, calm presence. He needed someone to get the triggers away. And he needed someone to say, what is it that you need? In order for him to turn off the survival mode and be like, oh wait, it's right here, I'm getting what I need. And it was really an amazing experience because he had a great conversation with me on the way out the door. Like it just completely changed. Once that he saw the Greyhound sight right then, once he knew I'm going home, it was like talking to two completely different people. So slow, you heard the way I did that, slow, clear communication. Offer limited choices. Not demands, choices. Right, go ahead.
No jargon. You mean no technical.
Nothing that he wouldn't understand.
Gotcha.
You talk just like him. If you're
to a 4-year-old,
yeah,
say it.
Yeah.
Got it.
Right? You don't, because again, you guys know what arrest development means, right? It's when you get stuck in the state you were in. Well, guess what some people go back to? Part of disassociation is going back to the age you were when the trauma happened. Right? So you're absolutely right. You don't want to cause the person to feel dumb. You don't want to use baby talk with them, but you simple, clear, open language. Very, very.
Is it, trying to cut you off, is it true that certain severe trauma can actually mentally stunt someone's growth?
Absolutely.
Oh, that's what I thought.
Absolutely, yeah.
Yep.
I've seen it. I've worked with people. I'm trained in prolonged exposure therapy. I'm also trained in EMDR therapy, which is the eye movement therapy. And I've seen people regress when we're working with them and they begin to disassociate and when they begin to behave differently. I've seen people revert to different patterns during that time and behave different ways. So validate the emotion. I can see you're upset right now. It's very clear that you're very angry, and I'm sorry you're feeling that way, right? I don't say you shouldn't feel that way, right? I'm sorry you're feeling that way. I'm sorry that whatever I'm doing right now is pissing you off. You know, the young lady that came to that session, I said, I'm sorry that my presence is making you feel unsafe. Right? Simple. It's just acknowledging exactly what she's telling me and apologizing for it, right? One of the things that I deal with most in couples therapy, honestly, is getting people to acknowledge the way their partner feels and not feel blame while they're doing it, right? And we're the same as clinicians, same as case managers, case workers, community workers. If we feel blame, we become defensive. If we become defensive, we create hostility. When we create hostility, we go in the wrong direction very, very quickly. Whether it's a relationship, a friendship, or in the work we're doing or in a justice system. So what do? We take ownership of what's happening and we acknowledge what they're feeling about it. Why? Because that's their true feelings. And it's okay for them to feel. And if I can be okay with them not being okay, we can have a really positive exchange during that process. So we want to validate their emotions. I can see you're really frustrated right now. We want to go ahead and accept. If it's because of the program, that's fine. It's because of the program. If it's because of me, that's fine. It's because of me. That's okay for you to not like me because of my face, you know, it's because I'm a man. Like, that's fine. If that makes you feel unsafe, totally okay. Go ahead.
Think about something you think. I had a guy who, I guess I was kind of new in my faith, so there's a lot of scriptures and crosses in my office, and this guy was an atheist, and he thought I was trying to bring him in my office to change his faith or his belief. I had no idea. I had no idea. He just went off. And he said, I'm not going into that crucifixion chamber. And I was like, crucifixion chamber? He said, oh, you know, and I didn't I wasn't aware of what I was putting up. I was just putting what I thought I needed in my office to feel safe and comfortable. And they didn't take him off my caseload. I just took all that stuff down.
Yeah.
I took all that stuff down, and he was like, "You did all that for me?"
Mm-hmm.
I said, "I did all that so we could work together."
Mm-hmm.
You know, and then I found another way. So if you go in my office today, you'll see frogs.
Yeah.
And everybody's like, "Why you got frogs?" If I ever relying on God, I found another way to be comfortable in my faith without offending anyone.
Yep.
I never thought that.
Yep. You know, I deal with that a lot. So I'm a Christian. I have it on my public profiles in my work, and I deal with it a lot. When I bring in a new client, whether it's in my own private practice or in this, they'll ask me, "Are you going to beat me up? Are you going to badger me with scriptures and with God talk and with all this stuff?" And it's like, no, I'm going to work with you to work on your needs and work on what you want. I said, I have to tell you I'm a Christian because it's not fair to you, right? You're coming to me for a service, and if I'm lying to you at the very beginning or withholding information, that's not fair to you. So I'm going to tell you the truth about myself so that you can make an informed decision about our work together. But if you feel safe that I'm that person, then hopefully I can build trust in you that I'm not going to force my agenda or the things that I might want on you. And it's a great way to just take ownership, right? Like, hey, I'm sorry that this makes you feel that way, but I'm here for you. I want to support you. I want to help you through this. It's just a great mental structure to have always in place, is be prepared to find ways of connecting and supporting them and acknowledging their fears, right? Because there was probably someone in his life that treated him like garbage because he was an atheist. And he's going to protect himself from that, because who wants to be treated like that? So, just like you said, reduce stimuli, right? This is very triggering and very traumatic. So you know what? I'm going to move this stuff. And I've even moved stuff and said, when you feel safe, let me know when I can put that back up. Because it does mean something to me. And I understand it's bugging you right now. But when you feel good about it, would you mind if I put that back up? 5 or 6 sessions in, oh, I just remembered. I forgot. I completely forgot you moved that thing for me. You know, you can put it back up. I don't really care. Why? Why? Because he trusts me now, or she trusts me now, and so it's comfortable. So what to avoid? Power struggles. Right? You did a great job avoiding a power struggle with him. You took ownership. You acknowledged his fear, and you supported him in it in a very reasonable way. Right? You offered choices and collaboration. Excessive questioning while dysregulated. It's exactly what you were talking about, right? When you have to get through a biopsychosocial, sometimes you got to stop. You got to back up. This is taking them out of their window of tolerance, and I got to stop, right? Go ahead.
Quick question. You've mentioned biopsychosocial a couple of times.
Yeah, so
exactly
a biopsychosocial is an interview you do. It's very formal, and it's a very structured thing, and it covers all of their biological data, any medical, mental, anything like that, psychological data,
So
and their social data. Yeah.
So it's a combination of like the PHQ-9 and the ACE and all that.
A little. If you were to take those and generalize them, it would. The biopsychosocial is going to tell you if you need those, because it's going to take their social history, their biological history, and it's going to take their psychological history.
Is there a preferred, like Columbia University?
No, there's every organization has their own, but the theme is going to be age, sex, and then like personality stuff, like a little bit about themselves, their substance use history, their relationships, their support system, their trauma history, their sexual history.
It's like a basic screening just to get somebody's background demographics. We'll ask about mental health and
If you've ever done an intake assessment, that's like 40% of the biopsychosocial.
Oh, yeah, I guess it is.
So same thing, so again, excessive questioning while dysregulated. You want to bring them back into the window of tolerance. You want to reschedule when necessary, because you never want to spend too much time outside of the window of tolerance, because you don't know what's coming next. Like with this guy that was in my office, I didn't know he was going to come in randomly one day and start violating my desk. Like, I had no idea, but he did. And so I needed to bring him back in his window of tolerance. That would not have been a time to be like, what's going on? What did you do? Did you get in trouble at work? Like, that would have been the wrong way to go about it. So avoid excessive questioning while dysregulated. Focus on safety and regulation. Figure out what they need. What's missing in that environment to help them feel safe? Match their intensity or tone, right? You don't want to increase while they're decreasing. You don't want to overtalk them. Silence is or a quiet, calm voice is the loudest voice in the room. People will get quieter to hear you when you're speaking calmly and quietly. I've seen it tons of times. That guy that was yelling and threatening to kill me, I didn't talk any louder than this, and he heard every word of it. You just don't need it. It's a tool. They're wanting that. They're waiting for someone to respond that way. So stay calm and grounded. Taking behavior personally, that's the biggest one. If there's anything you walk away from this training, it's this simple phrase: it's not about me. This has nothing to do with you. Go ahead.
Sorry, I work at Sadler Health Center, and one of the licensed clinical social workers has this phrase that says Q-tip. I had no idea. So what is Q-tip? Like, you know, you use it in yours? Quit taking it personally.
Yeah.
I was like, oh.
I love that.
I love that.
I'm gonna.
I can't stop thinking about.
I'm gonna steal that.
Yeah.
Yeah, I absolutely love that.
Quit taking it personally.
Yeah. That needs to be our new logo.
Yeah, right.
So,
I stole it from her. You can steal it.
You essentially have to preempt everything you're asking them to do.
Yeah.
Everything.
Every single thing, right? You don't want them to take it personal, right? Because what they're doing is they're reassessing your behavior through their trauma lens and taking it very personally, right? Well, if you're taking it personally too, it's over, you know? So I love that, Q-tip. Thank you for that.
Yeah, never saw it before in my life.
So practice depersonalization. What does that mean? Get out of yourself, right? It's not about me. It has nothing to do with me. I'm talking to this guy's trauma. I could be talking to a 5-year-old, an 8-year-old, a 7-year-old who's been through things that would extended my addiction a lot longer. Right? I often remind myself in this field when I'm working with challenging people, if I would have went through what they went through,
I'd be doing what they're doing.
What I didn't go through half of what they went through, and I did some insane stuff in my addiction and throughout my life. I can't imagine what I would have been like if I went through what they went through, right? We have no idea. And normally, we only get the half of it. We don't even get the whole story. So you have no idea what this individual's life was like. So the moment you can depersonalize, right, and disconnect yourself from it and not take it personal, you can really begin to function purely within the tools and the roles, right? And you'll often find out how much you enjoy it, right? Like some of you guys have talked about how joyful it was to see these individuals interacting with you when you came up with a way to meet them in their trauma. Yeah. It's exciting, like it's why we're here. So immediate problem solving or lecturing, right? You don't want to do that, right? You want to wait until the person is regulated, right? And the more you say, I see you're dysregulated, I see that you're upset right now, I understand that you're frustrated, now part of their brain says, oh, they know. So maybe I don't have to show them so much of it. Because part of it is I want them to know that I'm mad, right? And so they begin to present themselves in that way. And now you're saying, I see that you're angry. I wonder why, right? And then they'll start to answer the question, right? And maybe at first they don't even know, but they can tell you what they need as you begin to engage them more. So you bring them, all these things help bring them back into the window of tolerance. So we'll go to tools and mindsets for self-regulation. Does anybody need a 5-minute break? Okay, we'll just keep going then because we're pushing 10:22 and I'm going to try to get us done between 11 and 11:15. So why self-regulation?
No, I'm saying I love I'm thinking out loud. You cannot pour
She's
from an
like-
empty cup. I just love that.
I think that's a Freudian slip. I think
Yeah.
all that.
It's just perfect timing, that's all I'm saying.
Yeah.
So why self-regulation matters. Working with or supporting justice-involved individuals who carry heavy trauma can lead to secondary traumatic stress and burnout if you do not actively regulate yourself. So part of, like as an LPC, after you get a couple years under your belt, you can train other LPCs. The first thing I tell them is the number one cause of burnout, in my experience, right, has been lack of confidence in your approach. Right? And from the counseling standpoint, it's theory. From the trauma standpoint, it's your approach with someone who's dysregulated. Right? If you don't trust your navigation skills for that trauma, you're going to feel extremely dysregulated. And how many of you guys, and I'm sure, have felt like you failed a client? Right?
Yep.
You take that with you for a little bit.
Yeah.
You know, you reprocess that scenario multiple times because you're very aware that I could have done that differently. I could have done better, right?
And we sit in a class like this and realize, well, yeah, we could have done a lot differently.
Yeah, and what that means is there's always opportunity for growth, but the more confidence and the more you see, right, the more you see how impactful your interaction can be with them in regulating them and calming them and getting them what they need and even seeing some really healthy outcomes for them, the more excited you get to continue this journey. But if you're not using these tools and you're intensifying the explosiveness, you're not going to want to stay in this field long. You're going to check out very quickly. And we already have a really high turnover rate in the addiction field. Like the average is the same as healthcare. It's like 33%. It's extremely high turnover rate in this field, right? And a lot of that is because I don't know how to navigate these extremes. Right? So knowing these tools and really being grounded in them helps us retain in this field, because we all love, I'm sure all of us love working in the field we're working in, right? We love seeing the growth, seeing the life change, seeing people come back and all of that stuff. And so being able to be grounded in this, in the most extreme of events, really can help. I've seen people quit after episodes that I've been through multiple times. I've seen people quit, and I've seen people with trauma that, like you were talking about, they didn't know how to regulate themselves, so when someone else's trauma reflected what triggers their trauma the most, they couldn't do the job anymore, right? And so understanding your own trauma, self-regulating, depersonalizing, working through all that stuff really helps. So one study found over 53% of jail correction officers screened positive for PTSD. Right? That's huge. It's a huge amount of people with PTSD from being in an environment of other people's trauma, right? Much higher than many other first responder groups. Burnout strongly predicts these symptoms. So your ability to self-regulate, your ability to utilize healthy skills and get through those events successfully, and your ability to ground yourself, cope, and work on your own internal healing are all ways to prevent your own burnout and the sustainability in which you go through this field, and even prevent your brain from taking on some of those stress responses. So, like you shared, you cannot pour from an empty cup, right? You need to be able to work on yourself. You need to be able to do some of these different skills. So an unregulated supporter can inadvertently escalate situation or absorb the chaos, right? And that's important. We're all at risk. You know what's crazy? When I was in prison, my roommate was a counselor, and he was falling apart, right? I've never seen someone cry so much in my life. His problem was he absorbed his client's problems. He absorbed his client's stress, and he could not function anymore in society. It was the wildest thing I had ever seen, right? It was good promotion.
From him, like, being so involved with the client, or
he took it personal. He took it personal. Every failure was his fault. Every dysregulation. Think about it. If every suicide that you heard about in your direct space, we hear about it a lot, every overdose, if you carried that as your responsibility, you wouldn't last a month in this field, right? And he was taking that on. He wasn't processing it. He wasn't coping with it. He was carrying it, right? He didn't have the skills for self-care. Go ahead.
I've seen also, years ago when I was the clinical coordinator at Roxbury, where people basically, like, the job becomes how they fill their cup.
Yeah.
And so you don't have, if you don't have any other way to fill your cup, and then all of a sudden what's filling your cup is not the goodness you originally thought it was, then that's, when that situation starts happening, when whatever pathway or whatever you did personally to regulate yourself has become the job itself is how you regulate yourself, because you feel good from helping people. Yep. And then you have those struggles where the chaos and the stress and the continually feeling other people's trauma basically sort of almost poisons you. So it's not your cup's not empty, but your cup is so full, but it's full of like stuff that's not healthy for you.
Yeah, and that's universally true, right? It's universally true that there's a honeymoon phase to everything. There's a honeymoon phase to every new job. There's a honeymoon phase to every new relationship. There's a honeymoon phase to every new car, and then it becomes common. And so if you're not in a pattern of self-care, if you're not filling yourself up outside of those things, when that honeymoon phase is over, you're at high risk of not having the tools and the activities in your life and the coping strategies to cope with just how intense this field can be. Somebody had something?
I remember being in jail and, fighting, going to treatment, and I'm like, I'm just going to stay in jail. And the pastor came in and told me, he's like, listen, Brian, you have to fill your cup up. Unfortunately, your cup is full of oil right now. So you can't even put any good water in it because it's just bouncing off.
Yeah.
And I'm like, what are you talking about? He goes, no, all the things, the drugs and the actions and all those things. I wanted to get better, but I would never empty my cup of all the oil.
Yeah.
I just let it sit in there, and I would use the oil instead of pouring the good water in.
Yeah.
That's when it made sense to me. I'm like, okay, my cup does have something in it. It's just not the right stuff.
Yeah.
My thing was every good therapist needs a therapist.
Yeah.
And I always took long rides home, so work wouldn't come home. And I used to practice going in the bathroom, sit for 20 minutes because I had younger kids and they didn't deserve what I was working with inmates. Yeah. And I was like the only female staff. So there was a lot I learned. And self-care was very important. And extended work hours, feel like you're the only one can solve the problem. Nah, you gotta use your team. It's a lot of different things.
Yeah, absolutely.
I think the other thing too I've noticed is that as life gets bigger, the cup becomes bigger.
Yeah.
And so the things that I need to do in order to be regulated, the things like I need to do more.
Yeah.
And I think that's the struggle a lot of times for those of us that are in recovery and also in the field is like, well, I'm in the field, like I don't need to no really. I hadn't been in the field for a long time. I go to more meetings, which is my pathway today than I did before I took my job.
Yeah, absolutely. So. Yeah, your tolerance is expanding, and the things are having less impact the more well-grounded you are. Yeah, right? Like by the time I got, so from the first guy that was kicking my desk, I could not tolerate it. I was afraid of myself at that moment, right? Because of his behavior. By the time 10 years later, it was almost 12 years later, that the guy who was threatening my life, I wasn't even worried about it. I was completely calm. And I was completely okay with what was happening. Because I knew exactly what he was going through. And I knew this had nothing to do with me. He could be talking to a tree right now. Yeah. Right? Something is triggering him at his core. And I'm okay with that. Right? And I feel safe because I know this for a fact. And I believe it 100%. And if the moment he trusts me, this is going to change drastically. And that's exactly what happened. The moment he realized what I was saying was true, complete and radical change. Go ahead.
Yeah, I just wanted to add real quick. Yeah, that is so true, especially I know that the trauma piece works well with the substance abuse, but I had to learn that too because my own mental wellness, if I'm not taking care of myself, I cannot help anyone else. And when I first started, I was on this like, I gotta get everybody to treatment, but I know that I had to stop and I had to realize that, especially working in substance abuse for me, I feel like we are like in the belly of the beast. You know what I mean? And I, like you said, that Q-tip, I can't take everything personal, you know, that's like, oh man, I could get this person to go, and what did I say? I could have said this different or done this different, but and like you said, you can't take it personal. But I want to see everybody get it, but sometimes it doesn't always work like that. And the piece for me is I have to make sure that my own wellness recovery comes first before I can help someone else, because that's the only way that I'm going to be a positive force in anyone's life, and that's the only way I'm going to be able to help.
And the more you bring in, the more you have to give.
Right.
It really is an incredible field where as you bring in, you see how much.
Yeah, I love when I get the call. Oh, you help me, and you know, I have so many people in my phone that it's like client, and then people are calling me, who's this? And I remember, but that's a great feeling. But you have to take care. For me, I have to take care of myself first before I can actually help someone else. Because then, when I'm doing that, then you know the turnout is like much greater.
Yeah, and we have to hold on to those calls.
Yeah.
Right. Those are things that really encourage us and remind us what we're doing here.
Right.
You know, I ran into a client from 10 years ago. Last night I was in church, and he's sitting behind me, and it was just nice. Like I saw him 10 years ago in the program, graduated, got married, had first baby on the way, got a great job. You know, and it's just exciting. You see that, and you're like, this is why I do what I do.
Yeah.
So key mindsets for self-regulation, again, depersonalization. It's not about me. Like he was shared Q-tip, quit taking it personal. This person's reaction is shaped by their history, meeting the current environment. It does not mean the behavior is okay or that you have no boundaries, right? And that's a big stressor. Like again, I've been through some really rough environments with prison and all that stuff. So I wasn't worried about the guy threatening my life. It wasn't the first time I've had that happen. I had staff that called me and said, this guy's threatening, get out. Your physical safety, your safety is way more important than regulating this guy right now. And again, we got a drop-in center in Kensington. Some guy came up, very dysregulated, very threatening. I said, go stand in the front, call the police. I said, just don't stay in there for another second. I don't care about the computers. I don't care about any of that stuff. Get out. Get yourself out. She exits. The guy continues to dysregulate up there, whatever. She's safe. That's what matters. Your safety is always the most important thing. And if you assess that you're not safe, get safe. Empathy and boundaries. Hold curiosity about the person's internal experience, right? I get excited about it. I don't mean that in a negative way. Like I don't get excited that they're dysregulated, but I get excited about finding what it is. I get excited about seeing this individual calm down and hitting that button with them that's gonna get them engaged with me. So maybe I shouldn't look at it like that, but I do. I'm wondering. Yeah, I'm wondering what is it about this that's causing this? Yeah. And so you're maintaining those clear and consistent limitations. You're understanding the environment. You're assessing what they're going through. You're kind of doing this whole processing thing. But the more you're able to understand all of these things simultaneously in that moment, the easier it is for you to keep yourself, you're feeling the blame or taking personal responsibility for what's happening out of it, and being able to just assess them and be with them and be present for them and offer that calm presence. So co-regulation, calm your nervous system down, can help regulate theirs through tone, presence, breathing. You model the emotional safety many have never experienced, right? People can only stay in a dysregulated state for so long, right? There is a limit to it when their system's gonna run out of gas, right? And sometimes it'll escalate before it de-escalates, but whether or not it escalates versus de-escalates really is determinant on how much more intense the environment gets. So again, they want to run out of gas. They want to re-regulate. I've had clients who were dysregulated, didn't understand why, and were still somewhat mentally present, and said to me, I don't want to be like this. I don't want to feel this way. And I said, I understand. Do we know what's doing it? Because I want to help you figure that out, and I want to help you address it to the best of my ability. And I've seen it many different times. The other thing I'm going to say before we get into this slide, we had a client, right? And this is important. We had a client come in, and he was erratic, he was aggressive, he was verbally volatile to our physician, and we all really liked this guy. Like, I was there when we did his intake session. Super nice kid. But he gets into the doctor's office, and the doctor's doing his physical exam, and the guy's getting more and more volatile. And the doctor calls me and says, hey, can you come sit with me? This guy's getting irate. I want to finish with him. He's a great guy, but I can see he's becoming erratic and potentially violent, right? So I was like, sure, I can come sit in. And we get to the question on cigarettes, right? How many cigarettes do you smoke? This kid is a 3-pack-a-day smoker, right? He smoked like he was on meth. So the doctor's like, do you have a patch? And the kid's like, no. He goes, do you have gum? He's like, no. He's like, oh, hold on a second. He goes and gets 2 24 patches and three pieces of Nicorette gum, smacks one on each of the kid's arms and gives him the 3 pieces of gum. Within 30 seconds, the kid was like, just completely calm, re-engaged, making jokes, having a good time. It could be a withdrawal. It could be something you're not familiar with. And when it is caused by imbalance that's from an external thing, sometimes you have no clue what that can be. And so creating that space for them, the reason this guy didn't turn violent, the reason he didn't overly dysregulate, was simply because of our presence was both calm. Even though he added an extra person, he knew that I knew the guy. He knew that I did this guy's intake and had a good, positive relationship with him. And even when he called me, he said, hey, do you remember this guy? Do you have a good relationship with him? And I said, yeah. He goes, why don't you come down here and see if you can add some calm to the situation? But it was just the nicotine. This guy was a heavy, heavy smoker. He was in intense nicotine withdrawal, and that can absolutely stimulate someone's trauma, right? So this is practicing tools for self-regulation. How many of you guys are confident in your own coping skills? Right? So about half, right? I want to encourage you. One of the things I used to do when I was about 3 to 4 days out of someone leaving treatment, as I would say, I want you to be confident enough to teach me your coping skills. And only about 25% of my clients could teach me coping skills after a 30-day program, right? Because even though I know for a fact they were in the groups and all of those things, they didn't take them as seriously as coping skills really should be taken. So what I would encourage is, I know they're up here, I know you can find them if you Google it and everywhere, but I would encourage you to feel confident enough in a couple coping skills and a couple mindfulness and grounding skills that you feel good enough that you could teach them to someone else, right? And you can pull them during crisis situations. Because what we're not really familiar with and what we haven't practiced as kind of a muscle memory type of thing, we'll struggle to pull those up when we really need them, right? And what's the first thing that goes with every mammal that's in a fear state? Breathing. First thing, the breathing becomes dysregulated. Often shallow and quick. You're not doing the belly breathing. You're not doing... And when you see that, someone do that, you know something's happening with that person. Just me doing that alone, your brain attunes to that. Your brain attunes to when somebody's doing heavy breathing around you. You know that's working something. You know they're doing something. So your ability to do some belly breathing, belly is when you breathe so it comes in your stomach, kind of as a reflection of laughing, and your system regulates in association with your breathing. But also you start feeding your nervous system fresh oxygen. It's going to use that fresh oxygen to calm it down. So there's the box breathing. Frankly, I can't box breathe. The whole counting thing for me is, I got ADHD. I can count like through 3 breaths and then it's done. So
5 fingers.
Yeah, again, ADHD. I'll start biting my nails. My best way to do it is, this is my favorite way to breathe. You can pick your way of breathing, but my favorite way is I'll breathe in through my nose as much as I can bring in, and then I'll bring in a little bit more, and then I'll breathe it out all through my mouth. So. That for me is the most relaxing way to breathe. Everybody's different. I have clients who love the box breathing. I hate doing it with them, but I'll practice with them. Everybody's different, right? Find your best way of doing breathing. Practice breathing different ways. Practice belly breathing. And again, belly breathing is where you breathe and you let your stomach come out. And you push your stomach out. And you kind of usually do this in a relaxed kind of sitting state, and then let the belly fall in. It mimics laughing, and it mimics relaxation for your system. So your system begins to utilize, man, the chair's 2-0 right now.
No, Jackie got stuck. I don't want to sorry for the interruption.
No, you're good. I just, so again, that's my favorite way of breathing. Many of the breathing suggestions either have same or less in through the nose, longer out through the mouth. I find more in through the nose and less out through the mouth is I enjoy more. But that's why it's so important for you guys to practice. It really is. It's important to practice the breathing. It's important to be mindful of the breathing, aware of your breathing, aware of your nervous system. Feel your hands. Are my hands sweaty, right? The ways of kind of checking yourself to see if you're dysregulating, or your system could be dysregulated. So the box breathing is in for 4 seconds, 1, 2, 3, 4 in, hold for 4 seconds, out for 4 seconds, 1, 2, 3, 4, hold for 4 seconds, in for 4 seconds, 1, 2, 3, 4. If you enjoy that, do that. Then there's the 4-7-8 breathing, which is inhale quietly through the nose for 4 seconds, hold for 7 seconds, and exhale through the mouth for 8 seconds. Again, you're finding the pattern that works for you best. I don't necessarily enjoy that one. But then the next one is the grounding. This is a great tool to use with clients you have a lot of rapport with. Right? If you have rapport with them, they've begun to implement the skills. The 5-4-3-2-1 is a great way to ground them out in a session. Right? I use this a lot. I do a lot of telehealth with clients, and it's one I use very often where I'll have them communicate to me 5 things that they see, 4 things that they can touch, and I want them to reach out and touch them. I want them to feel, right? Because what's mindfulness? Mindfulness is present in the moment. When you're paying attention to what you're touching and what you're feeling, that brings you into the present. It's one of the big tools for, like we talked about, going back to the age they were when the trauma happened or the disassociation. I want to bring them back into the present. So 4 things you can touch, 3 things you can hear. Sometimes this doesn't work if they're in a really quiet room. And 2 things you can smell. And again, I'll just have them lift up their shirt, smell their armpit, just, whatever. And then 1 thing you can taste. And this just might be, rubbing your tongue along your teeth. You might taste toothpaste, you might taste breakfast, many different things. Then the pause is count to 5 or 10 before responding, right? This really valuable in relationships, right? A little tip for relationship advice is before responding, count, sometimes even to 30, right? Give the other person, because if the other person, remember how we talked about attachment styles, if the other person's avoidant, it's going to take them a long time to respond. But they will, if you give them the space to do it. So if you're in a relationship with someone, right, and this could be a family member, and they tend to get quiet when conflict comes up and not respond, using that counting method really gives the space to respond. But that means you have to be comfortable with the silence. You have to be comfortable with the pause. One of the biggest struggles with new therapists is growing comfortable with the silence, right? So allow those pauses to create room for two things. One, for them to process and talk. And if they don't talk, for them to process the last comment you said. Because if you said something really good and don't pause, they don't get a chance to process it and store it. So it has really great functions for you to self-regulate, be okay with the silence, gives them an opportunity to respond. And again, if you're pausing, that forces you to regulate, that forces you not to fill in that space, right? You're reacting a lot more strategically than you balancing your thoughts. Go ahead.
Also, that helps with not cutting each other off.
Yeah.
Because that happens a lot. I don't know why I pay attention to that, but I definitely do. Like, I know my aunt did that when I was growing up. Like, her lips would like be repeating what people were saying as they were doing it, and then she would like cut you off before you were done talking. And when people do that, it just, I just take notice to it all the time, but I just feel like it's very rude.
Yeah, you're absolutely right. And a side mindfulness activity for everybody in this room, especially when you're in a relationship with clients like we are, is stop thinking of your next question or your response while they're talking. And if you're not good at that, reflect what they're saying and then respond, right? Say back to them, so what you're saying is your aunt cut you off a lot and would kind of mumble what you were saying while you were saying it. And that you felt that when she did it. And then respond, right? Those are great tools to prevent that. Because for clients who never feel heard, it can be really, really hurtful for them to be cut off. Or honestly, for clients with intellectual disabilities, I had a client that had a 3rd grade reading and learning level. It took him a long time to process his thoughts, and he would become extremely agitated when he would get cut off. Because the other person would be excited once they got the concept of what he was sharing and want to fill in the space. But then that took away his autonomy to finish what he was saying. So he required that time, and it took a lot of people who were working with them learning to have that space and not to be thinking of their response while he was processing. So the body check, like I said, the body scan is what's going on in my system, right? This is the head to toe thing. What's going on in my head, what's going on in my chest, what's going on in my fingers. And here's the beautiful part of this, right? Is, like I said about the body bears the burden, if your trauma exists in a certain part of your body, my trauma existed in my neck and in my chest. My chest would get tight, my neck would get super red. Like I'm Irish, German, and Mexican, right? My neck and my cheeks would just get really red when somebody would trigger me. And I had very, very specific triggers. Well, part of doing my own therapy on those triggers was identifying the moment my chest started getting tight. And then assessing the safety of the situation. So I would hear the trigger, right? And it was a very specific trigger, right? I would hear that trigger, it was a common trigger, and I would identify and practice identifying when I felt it in my chest and when I felt it in my neck. And at that moment, I knew my immediate next response was to remind myself that I'm safe, that danger wasn't coming. Because before that, I would start a fight. I would create a problem to prevent my fears from being proven true. I would engage in a very unhealthy way, right? So a way to work through that was first to assess it myself. So the body scans are great tools for you to identify if this person's triggering something specific for you, and to know that dysregulation is coming. You began to feel it, right? When that client was in your office, dysregulation's coming. I need to do something for me to do something for this person. All right, so I can't express how much it is. And you can assess your breathing. Am I doing the breathing stuff? I know I'm supposed to be doing. You're practicing mindfulness, and you're getting yourself to the place where you're prepared to help the client. Now, the goal is to make this stuff second nature, right? The goal is to already be doing this when you see the person dysregulate. But in order to get there, you need to identify the lack of it and then begin to implement and make it a practice and see the value in it. So then debriefing with a colleague, right? It's really important. We do autonomies without blame, which is where we pick apart when somebody really had a big episode or when there was a big event, and we want to break it down without anybody feeling like they're at blame for it, right? And that's a great way to connect with colleagues and talk about it. If you have a supervisor or someone you can connect with, it's extremely important when you go through something like that to take the time to process it.
Yeah, I do that a lot. I'm got no problem calling it. Hey, listen, this is what happened, or sometimes I'm like, I don't need you to say nothing, just hear me out, or or I'll say, listen, I had a bad day. If I have to cry or whatever, I have certain people I will call.
Yeah.
Just to get that debrief part done, and then it you know what I mean?
Mm-hmm.
It helps get the load off of me, and then I can continue to do what I'm doing.
Absolutely.
I also like it to make other people aware that a person might have had a breakthrough today.
Right.
Yeah.
And because my shift is ending, making someone else aware about what happened with this individual so they can pay attention to their behavior or their activity. And it's very important.
Yeah, you're absolutely right. And I don't know how many of you guys have been through a traumatic episode, but it takes a lot of energy out of you. It really does. Even when it ends in healing, you're still feeling a little bit raw from all of the emotions and all. Like it pulls so many resources from your system to go through something that it's absolutely vital the next shift knows. I've actually given people bed rest after certain events where I knew they were just completely dysregulated and that they were going through something really tough. Just lots of grace for them, lots of opportunity for encouragement, and the awareness that, hey, even though he went through this thing, it doesn't mean he's in the green, right? He's in the journey. So we're at the end. I'm going to go over the key takeaways and then we'll do a Q&A. So trauma is extremely common, right? In justice-involved individuals. Behavior is often communication, right? Like I said, the more behavioral, the more physiological it is, the earlier the trauma likely happened, right? It's a great measure. When someone's nonverbal, meaning that's all activity, they're flipping chairs, they're kicking desks, right? Like I said, with the guy that was in my office, literally kicking my desk, talking to me, right? There was a dent in my desk after. 3 years old. Meaning the trauma probably happened since birth, right? Neglect, abuse, yelling, screaming, violence in the home. But his earliest memory of it was 3 years old, right? Go ahead.
I have a question. So when I was younger, I acted out like that. My family just called me like wild and crazy. But I would throw buckets and scream and yell and rip my clothes off and try to jump out of the vehicle and as a young child. You know what I mean? And I never understood what happened to me, but it was probably like trauma that I just didn't even recognize from when I was even an infant. So,
absolutely. And what's wild, right, is that, so I give you guys a story. I had a really good friend of mine. He's got 2 sons, right? One of his sons he gets along with wonderfully. The other son he can never seem to connect with. The kid is constantly scared. The kid is constantly, he's scared of like everything for no reason. Constantly afraid. He is, he's not into the things his dad's. He's just personality is drastically different. But the biggest marker of his personality is anxiety. Never had any trauma outside of the womb. So he's talking to me and he's like, why can't I connect with my son and why is he afraid of everything? And there's usually a cause, right? It's rare that there's not a cause, that your system's not working the way it's designed to work. I said, well, why don't you tell me about what was going on with you and your wife when she was pregnant with him? We were on the verge of divorce, financial collapse, fighting every day. She kicked me out and I was addicted to drugs.
Steve, you
How long?
You don't ever think about that. Like,
Yeah.
I know my mom did say, and I don't mean this in like, no, like boo-hoo, but I know my mom did say like, she didn't want another child. So maybe I felt that.
Yeah. And if she's carrying that in utero, you're sharing her blood.
Yeah.
All your system knows is I got way too much cortisol.
Right.
So guess what? You're, before you're even born, saying that everything's unsafe. Because the one hormone that's most prominent in your blood as an even pre-birth infant is stress and fear, right? So it doesn't make sense why these things trigger you, right? Why should it? When you were in the womb, you didn't have formal thought to say, oh, there's a little extra cortisol in my blood. No, it's just fear. You just a sense of fear. It's the same thing if I was to take cortisol and inject it in any one of you, you would have fear and no cause. Right? So what does that mean? You would have to find a cause for the fear. It's like when I work with people, a lot of things I do with my private practice, I help people modulate their diets, right? Because fluctuations in insulin can really cause intense spikes in anxiety, depression, all kinds of other things. And synthetic foods trigger people psychologically differently, right? And what I work with my heavy anxiety patients with is if you have anxiety that's caused by an external force, right? Something that you're eating is triggering you psychologically, you are going to find a reason for that anxiety. You're going to blame your spouse, you're going to blame your car, you're going to blame fear of something, like your spouse cheating, your kids dying. You're going to find a reason for that anxiety. But is it the chicken or the egg? Did the anxiety come first and then the fear? Or is it the fear causing the anxiety? Right? So many times that's what I'm trying to figure out is, does this make sense? And if it doesn't make sense, maybe it's not an experience causing the symptoms. Maybe it's the system causing the experience. Go ahead.
The other challenge too is so sometimes we look at like the big things is that's trauma. So like the guy being at war, like abuse, like like serious neglect, like that's trauma. But the small things can be traumatic too.
Oh yeah.
Over time as exposure, and so I think I took it was a training from the state on DDAP from trauma informed like care, and it was like that. The traumatic event doesn't necessarily cause trauma in every person. Like they don't actually respond. Like so, there's things that like that I might look at as my life was completely normal growing up.
Yeah.
And I didn't feel any trauma because of it, but somebody else experienced and they did.
Yeah.
And I think that's the challenge sometimes and stuff like that is we look back and you're like, well, my life was pretty normal.
We don't ever judge.
Was it?
We don't judge. We don't judge. You have no idea what that experience was like for that person.
I say that all the time because we can go through like similar things, but it affects people different. I think I keep that in the back of my head. Just like I'll use my addiction as an example. Like using a certain substance will affect people different.
Yeah.
You know what I mean? Like some people can act real quiet, some people can act real mild. But that's what my main focus is not to judge. You know what I mean? 'Cause you don't know what that person has gone through, what they're going through now, mentally.
Has anybody ever seen the movie Unbreakable?
Yep.
It's a great movie. I love movies and their psychological associations. It's got Will Smith in it, and so, I forget the actors in it, but I think, not Will Smith, Bruce Willis in it. And what happens is Bruce Willis is completely, completely indestructible. And then there's a guy, Mr. Glass, and if he bumps into a table, he'll break a bone. Right? There's a part 2 to that movie. I forget what it's called. But the part 2 is talking about trauma and how everybody breaks different when trauma happens. And there's no one way someone is supposed to break or should break or could break. Everybody's unique in how that trauma affects them, right? And what that trauma causes. For some people, it can seem like a mild trauma, but their system reacts to it in a very aggressive way. They don't get to decide that. That's the biggest thing. They don't control that. Their system controls that.
I grew up in a household where my mother screamed all the time. All the time.
Yeah.
The time we woke up to the time we went to bed. And it was her way of being authoritative. And probably was taught to her, but the point I'm trying to make is, now I'm an adult and I work through some of that stuff. As I'm aging, when people get loud, I jump. And my kids are like, why are you? I said, I'm being triggered by loud expression of conversation. It's unnecessary to me, but it's necessary for them.
Well, yeah, and your system does not want to go back there.
Yes.
Right? I know what this means, right? It was like so both me and my wife, and I'll share personally, both me and my wife had some trauma in our childhoods, right? So there were things I was doing that were triggering her, and there was things she was doing that was triggering me, right? And it was our trauma communicating. And so we had our first couple years was learning how to shut our trauma off about their behavior and to trust them that wasn't what our system was telling us it was, right? Because if it did mean, if our system was right, and my behavior did mean what it meant for her 30 years ago, I'm a dangerous person. I'm unsafe and she needs to get away from me, right? And that's what her system's telling. Is that I love you, but you're unsafe, and I don't trust you, because the things you're doing are reminding me of these things that were done before that made it unsafe. And so her system's reacting to me, right? She doesn't get to control that. She can desensitize herself to it through the process, but you don't get to control the initial response.
And that's what I was trying to explain to them. I'm like, I'm not used to all this hard.
Right? And again, my trigger is, again, a certain noise triggers me. I still have a response to it. It's minimal compared to what it used to be, but I had to go through that journey of finding safety in that and getting my system to understand everything's cool. Right?
I was in the program. I was meeting with a counselor, and when I was younger, my dad worked for the federal prison system, and for him to do that, he had to move out of state, and then he'd come home on weekends. And I understood it was for us growing up, and we needed money, and for him to have a career. But 20 years later, in a treatment facility, I said to my counselor, I said, do you think that bothered me? He goes, you're still talking about it. 20 years later, you're still talking about it, so obviously it didn't bother you. Let's break this down. But sometimes I think I didn't think it did. So that was really pivotal in my journey to start recovery, was like, if I'm still talking about it and thinking about it, even though maybe I don't feel some feelings about it or something like that, I still gotta stop going around this thing and then try to go through what, and we had a little bit of a session. It wasn't much, but he's like, you brought it up, so we gotta talk about it. Because if you don't, you're gonna hold on to that. And when you feel like you want to do something crazy, you're gonna hold right on to that and be like, this is why I did it. It really was,
And you're absolutely right. Identifying what the behavior is. What your system did something about that, right? It may not make a lot of sense, but your system was doing something to adjust to that, right? You're designed for kind of the nuclear family structure, right? All the research in the world says the healthiest outcomes are from the nuclear family structure, right? So when that is dysregulated in any way, when there's any interference with that, your system is going to make an adjustment to that. And it may be repressed for many years, right? But your system's adjustments, there's a high likelihood it's going to come out one way or another. And it can make sense of a lot of behaviors as a result of that. And once you make sense of it, you can do the compare and contrast. Am I reacting because of my experience in the past? And do I need to react that way anymore? No, absolutely not. I don't need it. That was my survival tool then, and I'm not in there now. And I can change the behavior. And when you're dealing with people with severe trauma, you're trying to teach them the same thing, but it's a slower journey and a journey that requires trust, right? Because again, imagine if you're trying to correct the course with zero trust in your environment. How hard that would have been. Okay. Any other questions? A quick side note, I actually thought about this, and this is completely based on experience. It's not a fact. This has not been researched. If any of you guys are ever going to go to a doctorate program and want to research something, you could do it and give me the data. But it's something I noticed in my own life, and I've noticed in a lot of the clients I worked with when it comes to trauma. And it's just a fun thing that I've noticed, so I figured I'd share it. Is that siblings make a big difference in your experience with trauma. And they, kind of like a crystal, breaks up light into different directions. What I've noticed in a lot of my clients is that the older siblings tend to take the brunt of unhealthy parents. And that kind of gets, what's the word for it? Diffused with each sibling down the road.
Yep.
And the younger siblings, and I'm the youngest, right? And I'm like, there was a certain point, and I'm going to say it this way, and I don't mean, there was a certain point where I was like, why is my brother so jacked up? Right? And I had to realize, like, he was the main hit of all of that was going on in the home, and despite how unhealthy he was to me, he was still a filter from all of that stuff that my parents had to grow out of.
Yeah.
Right? And I realized that there's something that happens when siblings are present that helps people cope with trauma, even when those siblings are unhealthy towards each other.
Yeah, I just wanted to add to that. It's so funny you said that because I used to tell people, like, I'm the oldest. So, and it took my mom like 30 years to say, you know, like, because I always felt, you know, there was a lot of trauma abuse. My mom was a yeller too, you know, and I grew up with a two-parent household, but it was my stepfather. But anyway, it's like, my mom would tell me, like, I made so many mistakes with you, and I noticed too, and there's 3 more kids behind me, there's 4 of us, that as she had more children, like I guess like the discipline got lesser, like she had to learn from me, and my brother that's right under me, he would say, yeah, and when you left, I got it, you know what I mean? But it's so, I guess I really believe that as you have more children, like, it gets less, but I'm the first one. I feel like I got it the worst. I started running away from home when I was 6, and I left completely when I was 16. And that was a lesson that I had to learn, but my mom told me that she learned from that too, and I guess that helped her be a little more easy in the way she was disciplining the children as she learned from me. But yeah, I believe that the oldest seems to get it first because, like, parenting doesn't come with a handbook. And I believe that, and I know for a fact that my mom was only raising me as she was raised, which she came from an abusive background, you know what I mean, where her father was abusive, and the answer to everything was hitting, you know what I mean? So she had to learn, like my little sister and brothers, like, they spoiled, and I didn't get that when I was, like, my life was, I felt my whole life was a punishment, you know what I mean?
Absolutely.
But they have to learn too, so I had to learn.
Well, First, I really appreciate everybody coming. Thank you guys for your participation. Thank you guys for sharing.
Thank you for coming too.
Absolutely. If you don't mind just doing your post test, again, you can do it on the slide or on the paper. It doesn't matter. All you'll do is turn that in. So it doesn't matter if you do it on the slide or not. They're exact same questions. If you don't mind doing those, and then after we do those, we'll do lunch.